Good morning, everyone. Welcome to our virtual Imagine Science Day. I'm Kristen Wells-Lewis, and I'm going to be your moderator for today. So sit tight. We want to make sure that you all engage as much as possible. So prepare some questions. We have a dynamic speaker who is going to share some great information with us today. Drop your comments in the comments section, any questions that you have, so that we can make this an interactive experience. And I am going to start by sharing some wonderful details about Imagine Science. What is Imagine Science? Imagine Science is an unprecedented partnership between 4 leading national youth organizations to bridge the STEM gap by igniting the imaginations of historically underrepresented youth. We believe that prolonged informal exposure to STEM increases a child's interest and builds a foundation for proficiency through high school and beyond. The Imagine Science Dallas team is led by 7 dynamic women from all of our 4 partner sites. We have Kristen Kelly with the YMCA, Cherry with Boys and Girls Club of Dallas, Erin from Girls Inc., Amanda also from Boys and Girls Club of Dallas, myself from 4-H, and Susanna from the YMCA. And we are led collectively by our program manager, Catherine. So these are the women who work together collaboratively to create engaging and dynamic content around STEM for youth across Dallas, Texas. So without further ado, we have a video that we would like to share with you all so you can see what our amazing students have been doing with the Imagine Science Collaborative. That was awesome, right? Unfortunately, due to the unforeseen circumstances around COVID-19, we have had a hard time connecting with this youth in the way that we traditionally do. And so we've joined to create other innovative opportunities for experiences like this. I want to start by introducing our speaker for today. Our speaker today is Dr. Fernando. Dr. Rajeev Fernando has been voted amongst New York's best infectious disease doctors for the past 7 years since 2014. He traveled to Wuhan, China in January to investigate COVID-19 when there were only 48 reported cases worldwide. He is an expert in the field, and he has been fighting countless hours on the front lines. Dr. Fernando strives to educate people on how to stay healthy during COVID-19 and also has a passion for helping individuals in need. Dr. Fernando provides his expertise to several organizations such as the Department of Homeland Security and Doctors Without Borders. Dr. Fernando leads Shiraj, a nonprofit organization he created on behalf of his parents, Shitra and Raj, based in New York. Shiraj's vision before COVID-19 was to empower women and children facing poverty and injustice one step at a time. Shiraj has served all over the world through medical missions, vaccination camps, and tsunamis. Shiraj's new mission and focus is to help individuals from under-resourced communities in America who have been impacted by COVID-19 with the focus on the youth. So you have a special opportunity to engage with a doctor who is not only practicing medicine, but also practicing and implementing solutions in our communities to help alleviate this terrible virus. So the next face that you will see on this screen will be Dr. Fernando. Dr. Fernando, welcome. I'm going to pass it over to you so that you can continue to empower our students.
Okay. Thank you, Kristen. Hey everyone, how's it going? It's Dr. Fernando from New York, and Kristen, thank you for that more than generous introduction. I'm not half the things that you mentioned, but I certainly do the best I can. So thank you for having me. I'm going to be talking about kind of stressful for you guys, with COVID-19 and going back to school and the difficulties. So I'm here to talk to you about that situation. And I also want to tell you how cool it is to be a doctor. And being a doctor, I can't believe I get paid for what I do. It's an honor and privilege to serve the community. I also have two of my students with me. One is a first year resident. The other is a second year resident, and this they'll be talking to you for a couple of minutes based on once you finish medical school, the ongoing education. So with that introduction, let's start off. Would you guys have any questions for me? Okay. All right. So thank you so much. Okay, so I'll start off with a little bit about what I do. So I'm an infectious disease doctor, and as an infectious disease doctor, we look for different bacteria or viruses all over the world, or fungi. These are different microorganisms, and we'll talk a little bit more about that. But these are organisms that all over the world, some of them are so small, you can't, as you can't even see these viruses. And what we call this is the unknown enemy. So with the unknown enemy, we can't really see what we're fighting, but we have different approaches how to attack these organisms, and we treat them. So the first thing is that Kristen mentioned that I'm the only American doctor to go to China to investigate this virus. A lot of you, it's really important. What I feel with education and things like that, but to always be brave, and be brave, and good things will happen. So that's what I did back in January, because I'd heard about these mysterious cases that were going on. And I went there to look into this case. While all the television stations out there said there was no human to human transmission or child to child transmission, as in this case, I didn't believe what they were saying. So why I had to go down and look into things myself. And that's why I want to tell all you kids out there as well. When you believe in something, don't be afraid to be different from others, because a lot of times in our world we can help save lives. So I want all of you out there to believe in yourself. That's the most important thing. When I was in school, I used to fail every single subject in school. I was one of the worst students ever. But oh, thanks. The YMCA of Metro Dallas is joining. Thank you, YMCA, for having me. And we're going to be sending you guys some masks as well. It's probably on the way. I hope you receive it very soon. It's Rise Up Texas Mask. Thank you for having me again. So once again, yeah, believe in yourself. And I had 150 kids in my class. Pretty much, I would do everything: sports. I used to do some modeling. Used to do exercise. Everything in college, of course. And the no one believed I could study, and everyone just they said that's not possible. Rajiv's going to go into television, stand-up comedy, or be a talk show host of the radio, which happened later on. But yeah, just believe in yourself. And when I go back to school and see my teachers, their jaw drops to the ground when they find out that I actually went to medical school. So it's very important to believe in yourself. Talk to your parents; they're always there for you to provide advice and things of that. But moving forward, I will tell you why it's so cool to be a doctor. And the most important thing is, a lot of people will tell you, being a doctor is you make a lot of money, but don't enter the field because of that. Enter the field because you're compassionate about others and love other people. Remember, it's a very difficult situation in the world right now. But I want all of you to love each other, love your friends, your classmates, whoever you play with at home. And unfortunately, you guys are new generation kids, so I want to tell you that color does not matter. Okay, it's really important. All colors are equal. God made people equal, and some people have different colors. So some people are black. I'm brown. With a cool tan from the beach. But they're all different colors. But they're all God's people, and I want you to respect all of them. So I'm gonna have two of my young apprentices right now, and they're gonna just give you some guidance on what it is to be a doctor. And I have David, Priya, and I'm Rajeev again. So I'm gonna give the camera to them, and they're gonna spend probably a minute or two each, and they'll show you what they did. We all work together as the infectious disease team, working hard to save coronavirus patients. And I just saw a patient this morning, and they're really, really sick. So it's important for all you guys to understand that. So I'll talk to Dr. David. He can come forward, and he'll tell you his story and why he decided to be a doctor. Okay, David? Hey.
Hi, everyone. My name is Dr. David Rovello. I'm from New York, born and raised in New York. One of the reasons that I really wanted to become a doctor is because I really enjoyed science growing up. I was always really interested in the field. Some of my friends went into business. Some of my friends went into marketing, other things. And really, what it is that drove me forward was my love of science. I worked in a mental hospital for a while when I was an undergraduate in college. And I liked it, but really what it is I wanted to do was I wanted to be a doctor. So I went back to school after I graduated college, and I took a number of post-bac classes, and I went on to medical school after that. And really the number one advice I can give you is to learn everything and make things make sense for you personally. Learning isn't always the same way for everyone. It's not the same kind of path where if I don't understand it by reading it, there's something wrong with me. It's absolutely not true. It's just a matter of spending a lot of time, really devoting yourself to it and realizing what it is you're doing is building towards something, building towards being able to help other people. That's really the most important point for me. I had a lot of friends in medical school who really struggled with certain things, and everyone's kind of working together. Being a doctor and being in the medical field, I feel is the most rewarding career that you can do. Obviously, I am a doctor, so I'm going to be, I'm going to love it more. But really, I think that anyone that wants to, number one, understand science very well and really wants to take care of people the best that humanity can, that we know how to, medical school is a great, great field. In terms of what kind of doctor you can be. So after you graduate medical school, you do something called residency, and that's what it is I'm doing now. So school never really stops. You're always learning more. You're always really kind of building on what it is you learned yesterday, the day before, last week, years ago. There's things I studied years when I was in your spot, and now it's making sense in different ways being a doctor. So that's really the key points that I really want to hit home. Like I said, if you study hard, if you work towards really bettering yourself and just come across with a positive attitude, that's what it is people love to see in the medical field, and I'm sure you'll go far. So I'm going to pass it off to my colleague, Priya. She's a year ahead of me, and thank you very much.
Thanks, David. Hi, kids. I'd like to introduce myself. My name is Dr. Chavon. I hope you can hear me and see me okay. I'm a second-year medical resident, and I'm from upstate New York. I think the first thing I want to say about why I became a doctor and what it means to me is that, like my colleague was saying, medicine is all about being curious and constantly learning. I remember being in your shoes at your age and sometimes sitting in class saying, when am I ever going to use this? Or why are we learning this? Some of the stuff we learned was not what I was interested in, but what I got out of school at a young age was that it teaches you how to learn. Elementary school, middle school, and high school really teaches you how to learn, and you're going to use those skills on how to learn in whatever career you go into. It teaches you how to interact with your classmates, present yourself, speak clearly, and think for yourself. And that's what I want you to really focus on at this stage in your life, and use it into whatever field you go into. I hope it's also medicine, but whatever you choose to do is fantastic. So medicine is a career for lifelong students and lifelong learning, and elementary school really teach you how to learn. And at the end of the day in medicine, it's something that'll really make you feel good about what you do. And I wish you all the best. I'll give it to Dr. Fernando.
All right, so I hope you learned a lot from my younger students. You're not going to learn much from me, so that's good. Okay, so getting back to, did you guys have any questions on coronavirus for me?
So yes, we have some students at our site locations that you got a chance to peek at earlier behind the scenes that are going to come on screen to ask you some of their questions. So we are going to start with the Johnston Outpost.
Hi kids, how's it going?
Good.
Good. How old are you?
I'm 9.
9 years old. Okay, good for you. And can you tell me your name?
Carissa.
Crystal. Okay, Crystal. Thanks for joining us. And tell us what your question is.
Is it easy to become a doctor?
Really, I think it's very easy to be a doctor. The most important thing is you have to have compassion for people. When you're going out on the road, like let's say something small, you see your friend fall down, hurt, maybe fracturing while bicycling, fracturing, a bone, and they're bleeding. I want you to be one of the first people to just run to your friend and make sure they're okay. All right. So the most important thing is you have to have love. So you have to love your friends, love everyone, and just compassion. So if you have those two things, and I really think with whatever that's going on, I think the world needs more love. And I think that's what we really need. So once you're determined to be a doctor, it's a long road, but you just, as long as you're sincere, you do your studies every day, I really didn't find it difficult at all. I mean, just do the right thing and you're going to do great.
Okay.
Okay, good luck, Crystal.
Thank you.
Yeah. Okay. All right. Who's this young lady?
Hi, I'm Romina.
Okay. How are you?
Good.
Okay. So tell me, what are your questions, kid?
After somebody has coronavirus, how much does the symptoms last? Like once they're
Yeah, good question. And really, with coronavirus, it depends on what age you are, and how, if you have a good immune system. So kids like you, usually you have a good immune system, so it's very easy for your body to fight coronavirus. But if you go older, as you get older and older, your body's immune system actually doesn't work so great. So when you are born, you're taking your mother's immune system, and so when you're young, you still have a good immune system. But sometimes people have sicknesses like diabetes, or they're on other medications that can make them very sick. But young adults and older people, they get very sick from this. Okay, but the chances of you getting sick is much, much lower.
thank you.
Thank you. That was awesome. Now we're going to go over to our friends at the West Dallas Boys and Girls Club.
Take your mask down and get ready. All right, you got it. Right there, right there.
How do y'all help people?
Hello, how are you?
Good.
So tell me, what is your question?
How do y'all help people with disease?
COVID-19.
Yeah, I think that's a great question. So people get sick, right? When people are well, things are good, but there are different types of sicknesses that can happen to a person. And when one feels unwell, that's when they go to see the doctor. So the doctor does some blood tests. I listen to you. I listen to your heart, your lungs, and I take what you tell me very seriously. So if you say, Dr. Rajiv, I have this problem, I'm going to say, well, okay, let's talk. Tell me more about what you have. And you'll tell me more and more. And then after that, the doctor starts to say, well, I wonder what you can have. What can you have? We may need to do more tests. That's important. But, I wonder what you can have. And then we order certain tests, and I'm able to tell you what exactly you have. Does that sound good? Good, good, excellent. Very nice
Good
talking to you.
job.
Okay. Good job, you guys.
Now, there's a note from the Boys and Girls Club of Greater Dallas saying thank you to you. And now we're going to head over to our friends at the Sierra Vista YMCA.
Hey, you guys, how's it going? It's Dr. Fernando. How are you?
Here, come up to the screen a little bit. Come closer to the screen. All right, there you go. It just got down. Sorry, we have everyone, so there's two things happening. All right, Lindsay.
Okay.
Meaning,
We can't hear it. Trying to get it. Maybe come a little bit closer or talk a little louder.
real close to the screen. Okay. Now,
Very good. How are you? How's it going? Good, good. So tell me, what's your question?
How did you become a doctor?
How does what? Say that again?
How did you become a doctor?
I can't hear too clearly, but Kristen, can you tell me what the young lady said?
She asked, how did you become a doctor?
Oh, it's very easy. Like I said, the first thing is you have to love poor people. Love people who have problems. So when you see people who are sick, they're helpless, they're very poor, even before you think about treating with medicine, you have to love people. That's the most important thing. So once you love people, and the poor people, a lot of people have a lot of money and a lot of people don't have money. So when you see every day people on the streets, they're asking you for some money. You see these people sometimes don't have money to buy a bottle of water. And these are people who are really poor. And a lot of times these are people who get really sick. So I worked in Africa for a while, and I used to see so many people like this. And every time I take out my wallet and give money, but it's never enough. And once I realize it's not enough, I start crying. And I ask myself, I wish there was something I could do to help these people, because we can help, but we can't help everyone. And it's very difficult. When I go on my missions abroad, I'm never happy when I come back. I'm going to come to Texas also soon to give some masks. But I'm never happy when I come back, because I realize I could do more. I wish I could do more, but I'm never happy. As soon as I get on the plane, I look down and I sometimes start to cry, because I say, I wish I could have done more. So before you start even thinking about medicine, I want you to love people. And once you love people, you do what you have to do to become a doctor. And being a doctor is so much of fun. You save lives, and your heart feels warm every single day. You feel nice about yourself, and it's just a wonderful feeling. I come to work every day. I sometimes work at 3 places, and I still can't believe I get paid for what I do. It's because when I come to work, I love what I'm doing. It's an absolute pleasure, and that's why I'm a doctor.
That was awesome.
All right, so Andrea.
Hi, my name is Andrea.
Can you tell me your favorite song in America now? What's your favorite song? What are you listening to these days?
Um, Open Eye.
Oh, it's a good song. Yeah, that's some good stuff. Yeah, that's good music. Did you hear Beyonce's new song?
No.
I think Beyonce's song is really nice. Did you hear it?
Mhm. No.
Okay, I'm gonna ask Kristen, and we're gonna send you a copy of that. All right?
Okay.
Okay. So what's your question?
How are the appointments online going to be like?
How are the lines to the emergency rooms? Yeah.
No.
No,
So
how are the online appointments?
Sorry. So a lot of people right now, it's a very good question you ask. A lot of people right now, because of COVID-19, they can't go out, and a lot of times it's unsafe. So people who are older, people who are sick, people who have weak immune systems, they can't go outside the house. It's dangerous for them. So what happens in that situation? We do online appointments. So we're able to talk to you just like you're doing right now, and like I'm doing right now, and we talk about to the patient and ask them what's going on, how you're feeling. The only thing I don't like about online appointments is I can't do a physical exam, which means if you tell me I have belly pain, I can't press your belly. That's the only problem. So I think it has its advantages and disadvantages. The advantages are you can stay at home and we can take care of this. But the disadvantage really is sometimes I can't do an exam of your belly. Does that make sense?
Yeah.
Yeah. So what I would do in this situation is I would say, why don't you start this medication? And why don't you start this medication? And I will call you tomorrow to see how you're doing. And to see how you're doing, if you're improving, I'm just going to say, okay, continue what you're doing. And if it's not, I'm going to say, I think you really need to come into either my office or the hospital. So everything in medicine is what we call a risk versus benefit. So we have to decide what are the risks for the patient versus what are the benefits for the patient. So if someone's at home and they have continuous pain, but they're old, so they can get COVID. But in this case, the pain is so bad for 2 days and not responding to medicine. So that's when I tell the patient, I think you need to come to the office. Does that make sense?
Yeah.
Good, excellent. I hope you be a doctor. It's a lot of fun, and it's just so much of fun. I enjoy myself every single day.
I do want to become a doctor.
You do?
Yeah.
Yes. That's awesome news. Thank you so much. That's great to hear. And you can talk to me anytime, okay?
Yeah.
Kristen has my information. If you guys have any questions, Kristen can send me a text or an email. I'm more than happy. I think, we have to give the young students like yourself a lot. We have to spend more time with you guys. So anytime you have a question about being a doctor, Kristen can send me a message and I will definitely answer you back, okay?
Thank you.
Of course. Okay. Nice talking to you.
Thank you. Great job. Thank you so much, Dr. Fernando. We really appreciate you taking time to engage with our students and answer all of their questions. We have some future doctors, as you can see. Most of these kids participate with Imagine Science through their partner sites, and we try to offer a variety of STEM programs. So this was awesome.
Thank you so much. It was wonderful doing it. And for me, this is so important because a lot of kids don't get we don't have the people to talk to the kids and tell them about the field. But being in medicine is just, it's so much of fun, and it's really great. Thank you so much for having me. And anytime you have questions, I'm more than happy to spend some time. I'm sorry, I had like an emergency, which is why I was a little bit late.
It's okay. You were being a doctor. So we totally understand. We totally understand. So we are just going to close out again with our video sharing about, the things that our kids are doing with the United Science. And we hope that you all and everyone else will join us again for our next virtual series. So
Excellent.
thank you.
Thank you again for having me. And bye.
Bye-bye, everybody.